I'm very excited by the Leaders Network. I think it's a fantastic opportunity for us to grow some informatics leaders from across the professions to fill the gap that we're going to have for the future. Informatics is definitely going to have a big role for the way we deliver health services in the future, and we need to think creatively about how we can grow people and enthuse people to take up the leadership challenge around informatics. I think it's leadership roles are always important. I'm a big advocate of clinical leadership, and I think that it's well evidenced that if you don't have clinical leaders in informatics, you are less likely to have a successful outcome for patients, and I care passionately about what happens for patient care, so I think it's a natural evolution for us. I'd like to see some creative work being done across the sectors, really, involving lots and lots of multidisciplinary professional groups to work out how we can grow people, how we can give them opportunities to learn and get an appetite for being a leader in informatics.
Well, I think it's been a great success. The room was packed out, which of course you would expect with the Secretary of State being there. This brings about a little bit of interest. I think more importantly, the discussion and the presentations that happened showed there's a real enthusiasm, a real burst of energy for this initiative. It's just not it's not just a good idea, it's also actually really right at the heart of what the informatics and healthcare should be about. It should be about clinical engagement, it should be about patient care, it should be about things that clinicians are employed to worry about, employed to think about. So what we're beginning to do now is join together a specialist area of IT that people have always felt in the past is just what geeks do, and it sits on a desk and beeps and flashes and stuff like that. But actually now closer to what people who work in healthcare that can deliver in care to patients care about. And having their influence at the centre of IT and informatics will make a huge difference to progress in the future. One of the things I've noticed actually going around the country, because I do a bit of national work occasionally, is some people are still cynical about it. They still feel that actually it's just a good idea and it doesn't really matter what, well, we don't need the CCIO thing, we can sort it out ourselves. I think what we should be doing now in the campaign is going around to people, showing them that it is actually directly related to patient care, that it really can make a difference. And when you see people like Paul Altman talking and other clinical leaders in the area, one of the CCIOs on stage today said, I became a CCIO as entitled because I think it's important to get it up the agenda. So it's spreading the message nationally and making people realise it is directly relevant to patient care. It's not just a good idea.
I thought today was excellent. I thought it was well attended. I think the quality of people was very good, and I actually think the quality of dialogue was very good. Good questions. My one comment for you, I thought Andrew Lansley delivered very strong messages, and I thought he was very supportive. I think like everything in life, and it's no different in any organisations, when you go down with initiatives like CCIO, etc., it has to have support from the top. So my suggestion for you, as the campaign gains momentum, I think it's the CEO support in the individual trusts and the support of the central bodies, whatever you call those central bodies, on making sure that IT and information programs are driven successfully. Our company, and remember, we've been acquired by CSC, so as far as I'm concerned, I'm talking from a CSC perspective as much as an ISOFT perspective. We're fully behind this campaign, and in fact our Chief Operating Officer's here as well, so not only am I here along with the ISOFT and CSC people, but we've also got senior management support as well. So I think it will gain momentum. I think the issue of maintaining that momentum and maintaining the interest is actually dependent on the trust delivering against the commitment of a CCIO.